Hello from all of us at MCPHS University. My name is Dr. Constance Anasio, Associate Professor in the Doctor of Physical Therapy program. Today, MCPHS students share virtual geriatric fitness testing and falls and balance screenings. The MCPHS Doctor of Physical Therapy students, as part of their course on geriatric physical therapy, learn about issues facing the older adult. Students learn to recognize the importance of promoting wellness in our community, especially in these times. The upcoming videos created by these students focus on general fitness, balance and posture, reducing falls risks, and other topics. We hope that you take away helpful tips to incorporate into your daily routine. Again, thank you.
Hello everyone. This presentation today is going to talk about what to expect and what's coming your way before and after getting a total hip or a total knee replacement, presented by the physical therapy doctoral students of MCPHS University. Whether you are thinking about getting a total hip or a total knee replacement, or you are scheduled to get one, this is a little information about the surgery and what you can do before the surgery to make your rehab after the best it can be. So the top two pictures are just demonstrating what your bone may look like before and then the implant after. The surgery itself is going to consist of removing old damaged bone and inserting a new prosthetic that will be made up of plastic, metal, and some cement pieces. Those top two pictures are dramatizations. They're very dramatic of what your old bone may look like, but it's just showing the difference from before and after. Things that you can do before surgery in order to make rehab the best it can be after is really strengthening the muscles around your joints. So strengthening your quads and your hamstring, your thigh muscles, as well as your calf muscles, and making sure you have awesome range at your knee or your hip. So making sure you could bend your knee and bend your hip as much as it can and extend both joints as much as you can in order to make rehab after optimal.
Conversations with your surgeon will help determine whether you are a candidate for a day surgery or an inpatient overnight surgery. Day surgeries do not involve a formal admission to the hospital, and individuals are discharged home immediately that day after surgery and will receive home care PT services in the coming weeks. These are reserved for individuals under 70 years old who are in good health and also have a strong support system at home of family members or caregivers who are able to provide them with assistance. An inpatient or overnight surgery involves admission to the hospital, followed by a 1 to 3 day stay after your surgery. Your medical team will assess your condition of strength, balance, overall health, and your support system and determine an appropriate discharge location. Some individuals are sent home, while others may be referred to short or long-term care facilities to receive additional rehab services.
After receiving your total knee replacement, your knee will look something like these two pictures at the top of this slide. Some things that you may expect post-surgery is some pain, stiffness, and soreness. However, these are all normal side effects of surgery. Your PT will see you within the first day or two and begin to walk with you and put some weight on your knee. During treatment with your PT, you'll be working on decreasing that pain, increasing the range of motion at the knee, and reducing that soreness from the surgery. Many people receive total knee replacements and do very well with recovery. Motivation and being optimistic are great things that will help you get through recovery and have a successful total knee replacement.
With a total hip replacement, the damaged bone and cartilage are removed and replaced with prosthetic parts. As you can see in the image on the left and top right, there are 3 components to the replacement to allow for normal and full function of the joint. You may have stitches or staples running along your wound or a suture beneath your skin. Those will be removed around 2 weeks after surgery. Following your discharge from the hospital, you may be sent to your home or to a rehab facility, depending on what your doctors feel is best. If you are sent home, there may need to be adjustments made to your home to make navigating around it much easier. These things can include adding handrails or a shower seat and removing loose carpets. A home physical therapist can help you determine what changes may be beneficial for you. Physical therapy will be a key part of your recovery You should be up and walking in the hospital within 1 to 2 days after your surgery and should be able to resume most normal light activities of your daily life within 3 to 6 weeks following your surgery. After your surgery and throughout your recovery, you may experience some pain, tightness, and discomfort with activity and after periods of immobility, like sleeping or watching TV. The PT will provide you with an exercise program for you to do at home on top of your physical therapy sessions and may even have you participate in a gradual walking program starting you off around your home.
After your surgery, you're going to be talking to your doctor quite frequently, but you're going to want to look out for some things like signs of infection that could arise before you see them in a follow-up. So in these two pictures, you see serious signs of infection of the redness and swelling around the healing tissue. Another thing to be looking out for is a blood clot, and that will usually present as pain, redness, swelling in the calf area. And something to prevent a blood clot would be one of these massage pumps that go around your shin, and it pumps air around it and massages the calf, and it brings that blood that's pooling up down there back up into your body and prevents a blood clot from forming. So things to think about after your surgery.
Thank you so much for listening to our presentation by the physical therapy students of MCPHS University. As always, refer to your doctor or your physical therapist before participating in any new activity. We hope we were able to give you some new information about what to expect for a total knee or a total hip replacement.
The senior fitness test must be administered by a trained professional. This presentation is strictly informative. Do not attempt to complete any of these tests without the supervision of a trained professional.
Welcome, and thank you for taking the time to learn about the senior fitness test. We are physical therapy students at MCPHS University, and today we are going to discuss the different tests involved in the senior fitness test, including what to expect during each of the different measures during the test and normal values for persons of different ages. But first, why is fitness testing important throughout life? Physical fitness directly relates to our ability to care for ourselves, lead vibrant lives, and continue doing the things we love throughout life. In other words, fitness is important in remaining independent. Physical fitness may also help prevent disease and slow down the progress of chronic conditions that are more prevalent in older populations. The senior fitness test was developed in the early 2000s and assesses functional fitness of seniors over the age of 60. The senior fitness test assesses strength, endurance, flexibility, agility, dynamic balance, and body mass index. So let's take a look at what's involved.
A trained professional will both demonstrate and explain how to complete each of the following tests. Again, it is important to note that you should not attempt these tests without the supervision of a trained professional. The senior fitness test includes the following tests and measures: the 30-second chair stand test, the 30-second arm curl test, the 2-minute step test, the chair sit and reach test, the back scratch test, the timed up and go, and body mass index. Next, let's take a more in-depth look at each of these tests and measures.
Alright, hi, so I'm here with my patient Emily, and today we're going to be showing you how to perform the 30-second chair stand test, which is one of the components of the senior fitness test. This test is really good because it's going to assess some endurance and also some leg strength. So what I'm first going to do is I'm going to instruct her to sit about midway through the chair. It's good that the chair is against the wall and it has no armrests. So once I have her scoot forward, I just want to make sure that her legs are nice and bent and that she's sitting up nice and tall. And so when we do this test, we first do 2 practice trials to assess her form and make sure that she's performing the test well. So when she's doing these 2 trials, we're just going to make sure that her knees aren't going over her toes. And we're just going to make sure that when she comes down that she's controlled in the chair and she's not just plopping down. So we're just instructing her here to put her arms across her chest, and then she's just doing these 2 practice trials. So she does both of those. These look pretty good. Her form looks good. She's controlled in the chair. So now that she does these 2 trials, we can now perform the actual test. So if you have your stopwatch, or if, in this case I had a clock on the wall, you're just going to count for 30 seconds. So once you say go, she can begin. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Here are the norms for the chair stand test. As you can see, they're divided into men's results and women's results. So all you have to do is find your age range, and then you want to be within the average or above average. If you fall below average for this test, it means you have decreased lower extremity strength and endurance.
Here we have the second portion of the senior fitness test, the 30-second arm curl test. In this portion, your PT will instruct you to take a seat in an armless chair. You will then scoot towards the side that will be performing the arm curls, and you will assume an upright posture. First, you will be able to take a couple of practice rounds. The first ones will be without the weight, just so that you can get the hang of the motion. Then your PT will introduce the weight. If you are female, you will get 5 pounds, and if you are male, you will get 8 pounds. You can then perform another set of practice rounds. The first will be slow, and the second will be fast-paced. This will be to ensure that you can move the weight through the full range of motion while keeping your elbow pinned, rather than letting it move out and up. After you got the hang of the motion and you've had a couple of practice rounds, you can take a break, shake it out. Your PT will then hand you the weight back once you are ready to perform the test. They will start the timer and you will be able to perform your arm curls. You will have 30 seconds to do as many reps as possible, as fast as possible. Notice in the side view that Kelly is maintaining an upright posture and not using the back of the chair as a support. She is also able to move the weight through the full range of motion while keeping her elbow pinned by her side. And that concludes our 30-second arm curl test.
Listed here are the normal values for the 30-second arm curl test. You can find your age on the left side here. So if you're from 60 to 64, the male average is 16 to 22 reps, while the woman's average is 13 to 19 reps. If your age is from 65 to 69, the male's average is 15 to 21 reps, while the woman's average is 12 to 18. From 70 to 74, the average for males is 15 to 21, while for women is 12 to 17. And from 75 to 79, the male's average is 13 to 19, while the woman's average is 11 to 17. And from 80 to 84, the male's average is 13 to 19, and the woman's average is 10 to 16. And then finally, from 85 to 89, the men's average is 11 to 17, while the woman's average is 10 to 15 reps.
The 2-minute step test is used to determine your aerobic endurance. For this test, you'll need a wall, a piece of tape, and a stopwatch. To set up for the test, the clinician will position you next to a wall and place a piece of tape between your knee and hip. To perform the test, you will march in place at your own pace, lifting your knees up until they reach the height of the tape. While performing the test, you can touch the wall or hold onto a chair to help you balance. If at all during the test you feel like you need to stop marching to take a break, it is perfectly fine to do so. And if at any point during the test you have to sit down or stop for any reason, just tell the clinician. After 2 minutes, you can sit down and the clinician will assess your score. Here are 2 tables showing the normal values for both men and women. The clinician will compare your scores with the normal values of your age group and report the results to you. For example, if you are a 73-year-old man, it is expected that you score between 80 to 110 marches. and a less than 80 would be below average score, and more than 110 would be an above average score.
Hi, so I'm here with my patient Emily, and today we're going to be showing you the chair sit and reach test, which is one of the components of the senior fitness test. This test is good because it's going to assess the flexibility of the lower leg, so particularly the muscles in the back of your leg, which is the hamstrings. For this test, what I'm first going to do is, so she's sitting good, but I want her to make sure that she's sitting about midway on the chair, so just have her scooch forward. Again, the chair's against the wall, there's no armrest. What I want her to do is we're going to test the right leg, so I want her to straighten the right leg out with the heel on the ground and the toes pointed up, but then her other leg's just going to be bent and stay on the ground. And so what I'm going to instruct her to do is to put her hands on top of each other, and we're just going to measure the distance from the third digit, which is the middle finger. And what I'm going to instruct her here to do is just have her reach for her toes. We're just doing 2 practice trials. Good, I want her to reach for her toes. What I'm going to be doing is I'm just going to be measuring the distance from the tip of her middle finger to the midline of the toes. So she's doing her second practice trial. So this is important to note that if she doesn't reach her toes, that the value gets a minus sign. However, if she goes beyond her toes, that value gets a positive. So here I'm going to measure. So this first measurement here I get is 4.5 inches. So now she's going up. So I'm going to have her do this one more time. We're going to take the average of the two. So now she's reaching in, so I'm going to go down and take my measurement. And so here I get 4 inches. So if we take the average, it's going to be 4.25 inches, and it gets a minus because she has not reached the toes yet.
Here are the norms for the sit and reach test. As you can see, they're again separated into men's results and women's results. So find your age range, and you want to be within the average or above average. On this one, the negative numbers means you did not reach your toes, and then the positive numbers mean you went past your toes. If you fall below average in this one, this means you have decreased flexibility.
The back scratch test is a measure of upper body flexibility, particularly at the shoulders and arms. Before completing this test, your assessor will instruct you through both a description and demonstration of how the test is completed. The assessor will also explain that if you feel any pain during the test will be stopped. Do not hold your breath or strain too hard, and avoid bouncing movements. You will be asked to complete 2 attempts during the test, so make sure to shake out your arms in between each attempt. Before starting the test, make sure to let your assessor know whether you have had any shoulder injuries or pain, as we would not want to continue the test to avoid aggravating your shoulder. So let's take a look at a demonstration.
In this video, I'm showing the patient how to do the back scratch test. What you want to do is first reach one hand over the shoulder and down the back, while the other hand around the back and up the middle, trying to touch. You can practice this with either hand on top so we can determine which side feels more natural. Next, you will see the patient is trying this test with one arm on top, and now his left arm. So in this case, his right shoulder is the one that we will test. Here I am measuring the distance between the middle fingers. We will have him perform this test 2 times, and the best score will be recorded. For this test, you will record the scores to the nearest ½ inch. If the fingers do not touch, as you see in the first picture, it would be a negative score. If the fingers overlap, as you can see in the second picture, this would be a positive score.
As we age, we may see a decline in our flexibility. The back scratch test is a way for us to determine if we need to incorporate flexibility training into your daily routine to keep you as functional as possible. The graph on the screen shows the different normal ranges expected for individuals of certain age groups depending on their gender.
So using this chart, you can find your gender and your age and see if your score falls within the norms.
The timed up and go test
otherwise known as the tug test, is used to assess agility and dynamic balance. There is minimal equipment needed to perform this test. That equipment includes a standard height chair, a stopwatch, a tape measure, and a cone. Prior to performing the test is described to the participant. First, the participant is told that they will begin in the seated position in the middle of the chair. Next, on the command of go, the participant will get up from the chair, walk as quickly as possible around the cone, and then return to the chair and sit down. The timer will start on the command of go, and it will stop when the participant returns to a seated position in the chair.
So here we have a table of normative values for community dwelling adults. As you can see on the left, there are age ranges. So first what you need to do is find what age range you fall into, and then look across, and after you find your gender, scan over and see what the average time it should take for you to complete the tug test is. For example, let's say that you are a 75-year-old female. You find your age range and look across, and you can see that it should take you roughly 9 seconds to complete the task from start to finish.
Body mass index, otherwise known as BMI, is a way to determine weight status depending on weight and height. In order to obtain the correct numbers, you must be honest with how much you weigh. BMI is important to know since a higher or lower number can increase the risk of disease. So the weight on this chart is shown in pounds on the left or kilograms on the right. Your height should be taken without shoes. So a normal BMI is rated 18.5 to 25. Anything under is categorized as underweight, and over could be overweight or even obese. So knowing this BMI can help you realize how much exercise is important at all ages.
We hope you enjoyed our overview of the senior fitness test. Again, please do not attempt these tests without a trained professional. The senior fitness test helps trained professionals such as physical therapists determine your levels of physical fitness, and it can help guide recommendations for exercise. Age-related normative values for each test offer a way for clinicians to compare your results to the results of many other people within the same age bracket as you. That way, the clinician can gear an exercise program or exercise recommendations to fit your unique needs to help you live a healthier and more fit life. We want to thank Worcester Cable TV, Worcester Senior Center, MCPHS University, and our professor, Dr. Ignacio, for making this presentation possible today. We hope you learned something new that will benefit you and your fitness in the future. Thank you for watching.
Hi everyone, we're students from MCPHS University in Worcester, Massachusetts, part of the Doctor of Physical Therapy program. Our names are Lauren, Amanda, Courtney, Stephanie, Christina, Kelsey, Abby, Carly, Maddie, and Nicole. Today we're going to talk about posture and balance and how certain exercises can help improve each of these aspects. We hope you enjoyed these slides, and we're excited to present them to you.
The first thing we're going to talk about is posture. So posture is defined as the position in which someone holds their body when standing or sitting. The posture plumb line, which is shown here in the photo on the right, is an imaginary straight line that goes from the top of the head down to the floor. So perfect or ideal posture means that our ears, shoulders, hips, knees, and ankles all stack up along this line, again shown here on the right. The next thing we're going to define is balance. Balance is an even distribution of your body weight, allowing you to remain upright and steady, whether that be sitting in a chair, standing on your feet, or balancing on a ball like these elephants are.
Lumbar stenosis is something that can occur in our spine as we age. In this condition, the spaces of our spine, most often in our lower back, become constricted and can put pressure on the spinal nerves that come out of that lower back. Symptoms may include numbness, tingling, and weakness in the legs or feet. You may experience this as cramping after standing for a long time or walking for a long time, or just overall general back pain. This can impact your balance. You may find it more difficult to lift your hips and your knees. You might experience foot slapping while walking, or just overall unsteadiness. And this is a result of those nerve roots becoming compromised. In the picture to the right, you can see that the man is walking. As he walks longer, he becomes achy in his legs and experiences some numbing. And then he has to take a rest. And then the cycle starts all over. This is something to be mindful of, and keep in mind that as our physical activity goes down, our balance is going to go down as well.
As we age, our heads move into a more forward position. This is known as forward head posture and leads to more weight put onto the cervical spine or neck. As you can see on the image here, the person on the left has their ears in line with their shoulders. The ears of the person on the right can be seen as more forward, not in line with the rest of the body, and the muscles in the neck are being overstretched. For every 1 inch of additional forward positioning of the head, there's an additional 10 pounds of force being placed on the neck. This new alignment of your body now changes your center of gravity and causes muscle tension headaches, which can alter your body's balance control mechanisms. What this means is that when you are faced with balance challenges and are relying on your body to help you, it is more difficult to return to a safe position.
The kyphotic index is an objective measure that we use to measure the kyphotic curve of the thoracic spine. The thoracic spine, which is that kind of middle region between the neck and the low back, is supposed to have about 20 to 45 degrees of kyphosis, which is a forward curving. Kyphosis beyond this range is typically associated with aging and osteoporosis of the spine. Now, osteoporosis is a bone mass loss, and it often makes the bones thin and weak. So when this thoracic kyphosis or forward curving becomes excessive, we can often see height loss, thoracic fractures, and chronic upper and middle back pain in elderly women. It has also been known that we can see some impaired breathing and increased risk of falls with this increased kyphotic index. This is why it's important to monitor this over time. Although this doesn't give us a lot of information at one time about your thoracic spine, over time we can start to see the measurements and prevent more of the kyphosis from occurring by implementing postural exercises and other physical therapy interventions.
A posture grid, shown here in the photo on the right, is a tool that is used to assess someone's posture in sitting or standing. It can be used for education on proper posture, and it is designed to provide a visual representation of an individual's posture in order to aid in correcting postural deviations.
Next, we are going to discuss about the components of proper sitting posture and ways to improve posture. We first start with flat feet on the floor, knees bent to be about the same level as your hips, back against the chair, shoulders nice and relaxed with the ears and aligned with them, and most importantly, having that object such as a computer screen, in front of you at eye level. Strategies to improve include strengthening abdominals and back muscle groups such as your extensors and flexors, improve alignment and flexibility, as well as initiate spinal decompression strategies. Sitting balance and posture can be assessed by asking how well the patient can maintain center of gravity over the base of support, such as their head and their trunk, over their hips when they're sitting. Are they able to recover center of gravity over base of support when balance is disturbed, such as standing in a crowd or sitting on a bench and someone bumps into you? Are you able to stay where you are relatively to the ground, or are you knocked over? And the ability to adjust center of gravity over base of support when performing a transitional movement, such as sitting to standing. That momentum from back to front and going from down to up. Are you able to stay within your base of support? And lastly is the incorporation of your sensory system. How is that affecting your ability to know where your body is in space and using those visual cues? The sitting balance scale assesses the performance of various functional activities. They are listed in the table below. Each activity is scored on a scale of 0 to 4, 0 being the worst, 4 being the best, and adding the total amount amongst all the activities tested. The higher the score, the better that the person is able to keep their center of gravity over the base of support. Here are some at-home exercises to improve sitting balance and posture. Seated scapular retraction can be done seated in a normal chair. Squeeze your shoulder blades as if you're trying to hold a pencil. Hold and repeat for about 10 reps, 5 to 10 seconds, just trying to get those back muscles activated and helping you keep that open chest. Cervical retraction or a chin tuck, just trying to push your head back into the wall if you're seated against the wall, and just trying to correct that cervical curve, from the excessive forward head leaning. Next, we have heel slides, basically just sliding that heel nice and forward, just stretching, improving flexibility and alignment.
Earlier in this presentation, Kelsey mentioned what was considered to be ideal posture. It is important that we have proper standing posture as it helps to keep our spine strong and stable and allows it to maintain its natural curves. It avoids putting pressure on our back muscles and ligaments that otherwise excessively strain to help us keep our balance with poor posture. Poor posture can result in difficulty with walking and difficulty with breathing, as poor postural habits can restrict your rib cage and put extra pressure on your diaphragm, your major breathing muscle. Poor posture can also be a contributing factor to body pains, including but not limited to back and neck pain and headaches. A simple way you can check your standing posture is by using a test called the wall test. Standing tall with the back of your head, shoulder blades, and butt against the wall, and your heels positioned 2 to 4 inches from the wall, place one of your hands between your lower back and the wall. Ideally, you should be able to just barely slide your hand between your lower back and the wall. If you find that there's too much space between your lower back and the wall, you can draw your belly button in towards your spine. When doing this, remember not to hold your breath and to stay upright and relaxed. If you find there's not enough room between your low back and the wall, you can arch your back just slightly so that you are able to barely slide your hand between your back and the wall. Once you have established this optimal standing posture, walk away from the wall while trying to maintain the posture. Return to the wall again to check whether you kept this proper posture. Here we have provided 2 stretching exercises that you can do at home on your own at any point during your day. The first is an overhead stretch. To do this one, find a sturdy wall and with your back against it and standing upright with your feet shoulder width apart, interlace your fingers. Bring your arms overhead while ensuring that your elbows are straight and reach toward the ceiling. Hold the stretch here for 20 to 30 seconds, then relax. Repeat this stretch a few more times. The second stretch provided is a standing calf stretch. Again, using a sturdy wall, stand about arm's length away and place one leg closer to the wall and the other behind. The leg closest to the wall should be bent and the leg that is placed behind should be straight with your heel on the ground. When doing this, be sure to keep your back straight and have both of your feet facing straight ahead toward the wall. Hold the stretch for 30 seconds, then switch legs and have the leg that was behind now in front. Repeat this stretch a few more times on each leg.
The study, which stands for Stopping Elderly Accidents, Deaths, and Injuries, is a great tool used by healthcare providers in order to help reduce fall risk among older patients. The study consists of 3 core elements, the first being a screening for patients for fall risk, the second assessing modifiable risk factors, and the third intervention to reduce risk of falls. Most falls occur because of a combination of risk factors shown in the table. The more risk factors a person has, the greater his or her chances are of falling. Healthcare providers can lower a person's risk by reducing or minimizing that individual's risk factors. Some of the intrinsic risk factors include previous falls, muscle weakness, gait and balance problems, poor vision, postural hypotension, chronic conditions including arthritis, stroke, incontinence, diabetes, Parkinson's disease, and dementia, and also fear of falling. Some extrinsic risk factors include lack of stair handrails, poor stair design, lack of bathroom grab bars, dim lighting or glare, obstacles and tripping hazard, slippery or uneven surfaces, psychoactive medications, and improper use of an assistive device. The first component of the study is the patient will fill out this Stay Independent brochure. You can find this brochure on cdc.gov/study. I'm going to read each question to you and I want you to answer yes or no. I have fallen in the past year. I use or have been advised to use a cane or walker to get around safely. Sometimes I feel unsteady when I am walking. I steady myself by holding onto furniture when walking at home. I am worried about falling. I need to push with my hands to stand up from a chair. I have some trouble stepping up onto a curb. I often have to rush to the toilet. I have lost some feeling in my feet. I take medicine that sometimes makes me feel lightheaded or more tired than usual. I take medication to help me sleep or improve my mood. I often feel sad or depressed. You will now add the number of points for each yes answer. If you score more than or equal to 4, your healthcare provider will then evaluate gait, strength, and balance. This will be shown in the upcoming slides using our standardized outcome measures. If you scored less than 4, then you are considered low risk and individualized fall interventions will be implemented. All these tests within the study should be done with a healthcare provider in order to ensure safety of the patient.
Part of the study consists of 3 standardized outcome measures. The first is the timed up and go, otherwise known as the TUG. The purpose of this test is to assess the patient's mobility. The equipment needed is a stopwatch, a standard armchair, and a distance of 3 meters or 10 feet. The participant should be in their regular footwear and an assistive device such as a walker or cane that can be used during the test.
The procedure of the TUG is as follows. The patient will sit in the chair, and as soon as I say go, the patient will get up from the chair, walk to the cone, walk back, and sit down. As soon as the patient sits back down, I will stop timing. The number recorded will be the time in seconds it took from the patient to walk to the cone and back. I will be using a gait belt around the patient in order to maintain safety. So when I say go, I would like you to get up from the chair, touch the cone, and then walk back. Ready? Go. The time it took the patient to complete the test will be recorded, and according to the CDC, if it took the patient longer than 12 seconds to complete the test, they will be at risk for falls.
The second standardized outcome measure to be performed will be the 30-second chair rise. The purpose of this test is to assess lower extremity leg strength and endurance. The equipment needed is a standardized chair and stopwatch. I'm going to have the participant in the middle of the chair place their hands across their chest, as so, and keep your feet flat on the floor. And when I say go, I would like them to rise up to a full standing position and sit back down for 30 seconds. I'll be counting the number of times the participant is able to perform this.
We are now going to demonstrate completing the 30-second chair.
Okay, so when I say go, I want you to stand up into a full standing position and then sit back down in the chair. I want you to do that as many times as you can in 30 seconds, okay?
Okay.
Ready, set, go. Okay, stop. The final SOM in the study is the 4-stage balance. The purpose of this test is to assess static balance. The only equipment you will need is a stopwatch. The participant will not use an AD and will have their eyes open for the entire time. The participant will try and hold each of the 4 positions for 10 seconds. The first position you will have is your patient is in feet side by side. The next position is placing the instep of one foot so that it is at the big toe of the other foot. This is also known as semi-tandem. The third position is tandem stance, where one foot is in front of the other in a heel-to-toe manner. The final position is standing on one foot. If the participant is unable to hold any of the first 3 positions, they're considered a falls risk. Okay, so first, Christina, I would like you to put both your feet together. I'm going to count to 10 seconds. Okay, good job. Now I want you to place the instep of one foot so that it's touching the big toe of the other, and you're going to hold that for 10 seconds. Okay, good job. Now you're going to proceed to do the tandem stance, so just make sure that your heels are, the front of your heels touching the back of your foot. Okay, good job. And the last position is standing on one foot. And hold that for 10 seconds. Okay, and stop.
The Otago Exercise Program is a great home-based exercise program delivered by a physical therapist that is tailored for individuals 65 and older. It is individually tailored to include walking, strength, and balance exercises. It has been shown to reduce falls and falls-based injuries in high-risk participants. These include individuals especially over 80 or several comorbidities. This is usually prescribed after a study is completed or another balance measure. So as mentioned above, the study consists of the tug, 30-second chair rise, and a 4-stage balance test, which will all be performed by a physical therapist before the exercise program will be prescribed. This can be prescribed by referral from a PCP if there has been a fall, or through direct access by accessing the physical therapist first. It can be covered by Medicare Part A or B, Medicare Advantage, or a third-party insurer.
So this program will consist of a warm-up, strengthening exercises, as well as balance exercises. So to start off, there will be 6 exercises to warm up, and those include standing marching with the support from a chair or countertop, which is shown in the picture to the right, neck movements that include chin tucks, back extension, as well as various trunk movements. Moving on to the strengthening exercises. Those include a seated knee extension, which is depicted in the first picture to the right, standing hamstring curls, which is depicted in the second picture to the right, standing hip abduction, which just means kicking your leg out to the side while you're standing with a chair or countertop in front of you, heel raises, which is where you come up onto your toes and bring your heels off the floor, as well as toe raises, which is where you bring your toes up off the floor and come and rock back on your heels. So now we're going to move on to the balance exercises. Now these will start off by having some support of a chair or a countertop, and then as you gain confidence with your balance, you'll move on to doing these exercises unsupported. So some of these exercises include having your knees bent, almost doing a mini squat, toe walking, which just means you're going to rock up on your toes and walk like that, tandem stance, which means one foot will be in front of the other, where one heel is touching the toes of the other foot, standing on one leg, so all your weight will be on one side, side walking, heel walking, which is like toe walking, you're going to roll back onto your heels this time, and you're going to walk that way, as well as a sit to stand, which just means you're going to sit in a chair and stand up like you normally would.
Further information about the Otago exercise program can be found by contacting your physician or family doctor or the physical therapist that you may know. You can also visit this website at the UNC database, and it gives testimonials, videos, tools for practice, a way to find your therapist, and different reimbursements and billing for the Otago exercise program can be really beneficial for more information. And lastly, this YouTube playlist gives demonstrations of all the different exercises that Amanda had talked about in the previous 2 slides. And this can give you an idea of what these exercises look like and what you could expect if you were to be prescribed the Otago exercise program. So this concludes the end of our presentation on posture and balance and their effects on aging. We hope that this was very informative and educated you on the different aspects of balance and posture and how these can decrease with age and how they can also be improved with postural exercises. So hopefully these exercises were informative and easy to replicate at home in your home environment. The study is a great tool that can be conducted with the help of your physical therapist. So I recommend talking to your doctor or a physical therapist about this to see if this would be beneficial for you. The Otago exercise program can be very helpful for individuals who have mild balance deficiencies. So again, after completing this study, you might qualify and be able to participate in these at home. Lastly, MCPHS in Worcester has a Balance Movement and Wellness Center. This center offers a free group exercise program that focuses on each participant's individual needs. They are usually 75-minute sessions that occur twice a week for 10 weeks in our facility. Participants will work directly with students under the supervision of faculty and in a fun and supportive environment. This helps to improve their balance, flexibility, endurance, and overall wellness. With the COVID pandemic going on right now, we are taking every precaution necessary. There is regular testing, masks are being worn in the building, and people are being limited to the amount of individuals in each session. So if this sounds interesting to you and you want more information, please call 508-373-5741. We hope this presentation was very informative and that you enjoyed it. Thank you.
Hi everyone, today we're going to spend a few minutes talking about home safety. We're first going to talk through a quick environmental assessment inside the home. Home safety is a very important conversation. So to start off, some environmental factors to consider inside the home include wet floors and cleaning up spills as soon as they occur, throw rugs, stairs without rails, and some tips on stair safety include putting colored adhesive tape on the edges of each stair, repairing broken or loose stairs, installing railings, and making sure that the stairwells are lit properly. Some other factors to be aware of that may hinder home safety include lamp glares on the floor, long bedspreads, clutter, dim lighting, low chairs or toilets, extension cords or other cords that may be laying around on the floor, deep pill carpets, and a lack of safety tools such as proper assistive devices or grab bars near the toilet and outside of the shower, as well as pets and pet toys and pet leashes and all of that stuff that kind of goes along with the clutter. In general, all of these different factors can really be tripping hazards, so it's important to be aware of them. Some other tripping hazards to be mindful of outside of the home include uneven ground, wet leaves, curbs, escalators, obstacles in your pathway, and loose rocks and debris, as well as icy and snowy surfaces. Especially here in New England, we know how tricky that can be. Large crowds, stairs without rails, again, that's a big one both inside and outside of the home. And another one to consider is crosswalks and having enough time to cross the street safely.
Now we're going to look at a functional assessment for your home safety. So now we're going to talk about some tips and tricks for home safety. We want to make sure we're eating 3 meals every day and drinking plenty of water to stay hydrated. Focusing on one task at a time can make it easier to maintain your balance while walking. If there are multiple tasks we're trying to focus on, it can be really challenging. Keep a phone or a flashlight near your bed or your seat in the living room. They're great for emergencies. Consider daily check-ins with your family and friends so they know you're doing all right. Tell your doctor if you have any falls, even if you feel like you weren't injured. Consult your doctor about wearing proper footwear. Wearing shoes without backs, like sandals that don't have a strap around the heel, or wearing shoes that are too big, or shoes with soles that are too slippery may increase your risk for falls. It's also important to be mindful of thresholds getting into your home and throughout your home. Some other things to be mindful of that assist with home safety include overall safety awareness and your personal judgment. Knowing what your mobility skills are and staying active, as well as being mindful of your problem-solving skills and consulting your doctor about any and all physical impairments or sensory impairments that you're having. It is also important to consult with your doctor about any equipment around your home that you may need for assistance and how to use such equipment properly. Pieces of equipment that could be helpful include grab bars or shower mats in the bathroom, a bed rail or an elevated toilet seat, and night lights throughout the home in case you need to get up in the middle of the night. So overall, our goal for all of you is to stay healthy, stay active, and most of all, stay safe.
Hi everybody! We are here today to talk to you about depression and how to help prevent depression in older adults. My name is Julie, and I am presenting today with my peers Ed, Ryan, Sarah, and Morgan. We are second-year Doctor of Physical Therapy students at MCPHS University. So first, let's define what exactly depression is. Depression is the disorder of affect characterized by mood, often mimicking cognitive impairment. It is more common than you might think, but it is not actually a normal consequence of aging. It's often found more so in older adults who are in the hospital or long-term care facilities, and depression does frequently go undiagnosed.
So for warning signs, the cause of depression is poorly understood, but is associated with changes in neurochemicals in the brain. There are risk factors, however, such as general body changes that one might experience with aging, such as not necessarily being as strong or as fast as they were, or being retired and not seeing coworkers or family members that have moved away, psychological stressors such as going to the doctor's office or how you're going to pay for expensive medication. There are medical conditions or disabilities that are also warning signs that might make you less active as you were, such as a fall or a stroke. And there are certain things that can mask depression symptoms, such as pain or anxiety or disabilities.
Research has shown that 1 out of 20 community-dwelling elderly are living with depression, and it commonly goes undiagnosed. It can manifest physically in the form of pain, weakness, dizziness, and shortness of breath. So if this or any of the warning signs from before happen to ring some bells, it's important to take action. So an easy way of confirming if you're living with depression is the Geriatric Depression Scale. It's an easily understood questionnaire with 15 yes or no questions. These are the first 9 questions on the scale. If you'd like, pause the presentation and take a moment to answer them to yourself. The answers in bold are the answers that are worth 1 point. These are the last 6 questions and the interpretations for your score. Any score greater than 5 has been proven to correlate with depression. So if you or someone you know happen to score higher than a 5, it's crucial that you get help and take action. There are numerous ways to prevent or cope with depression. Listed here are a few that we're going to go over, and we're going to provide you with resources to access more information. Also on this page is a link to the AARP and free resources that they provide to help you combat depression.
So, ways to seek help for depression. You can see your primary care physician. You can visit other mental health specialists, such as psychiatrists, psychologists, psychiatric nurses, and social workers. There are also many concerns about seeking help for depression, mainly the stigma surrounding it, additional treatment concerns when going to the doctor. You may be concerned about how expensive going to the doctor can be, and you may have limited transportation. In fact, the doctor may not speak your language, or it may be your second language. These really shouldn't stop you from seeking help, but if you don't want to go see your PCP or a mental health specialist just yet, you can visit AARP, and they have ways to stay connected. There are support groups, you can receive advice, and you can be seen for your specific demographic. You could, if you're a female, if you're a veteran, if you're a disabled person, it's all there.
Staying connected with friends and loved ones is a great way of coping with depression. There are even support groups that can help you discover ways of coping as well. And connecting with anyone has been made easier with the help of online communication platforms, or basically virtual visits. With the COVID epidemic, online communication platforms have become very popular and user-friendly. Zoom is an example of an online communication platform where you can have real-time, face-to-face conversations with friends and family, and even meet new friends. There are several ways to learn the platform. If you prefer to read instructions on a document, then you can click on the Zoom Setup Document link below. Or if you prefer an online tutorial with a video with somebody telling you how to do it, you can click the bottom link for a Zoom tutorial provided by the AARP. Shown here are the 2 different kinds of instructions that you can get to help you set up Zoom. On the left, this is one of the 2 pages of the Zoom setup document, just to provide you an example. And on the right is what you'll see when you visit the website on the second link. If you notice the arrow on the right, it's pointing to the button that you can click that will play the tutorial for you. It's about 45 minutes long.
One thing to look at is playing games and doing puzzles online. You don't need a membership to play most of the games that you'll see on different websites. The focus is that these games and puzzles are good exercise for your brain, as it incorporates things such as memory, critical thinking, using reason to answer questions, and it makes you pay attention. These skills help keep your brain engaged to help battle depression and stay happy. Above include links to brain games to keep your mind active, such as the AARP website, with included crossword and Sudoku links. One method we found that helps adults is adopting a pet to avoid loneliness, staying socially engaged, and staying active rather than living a sedentary lifestyle. Even if you can't adopt a pet, you can still go to a shelter or work in a pet service agency to gain the relationship of the pet without also having the extra work of having to take care of a pet, if that ownership would instead become a burden rather than a relief.
Another effective strategy for reducing the symptoms of depression is engaging in physical activity. And research has shown that exercise can be equally or even more effective than antidepressant treatment for this. Some easy ways to increase your physical activity are opting to take the stairs when possible, going for walks in the park, gardening, taking some exercise classes, anything like Tai Chi, water exercise, yoga, just really anything that keeps you active and keeps you moving is going to be an effective way to reduce any depression symptoms.
And lastly, we just want to say thank you for listening to our presentation. We hope it was helpful, and we want to wish everybody a happy St. Patrick's Day.